My name is Dr. Mark Feinberg, and I'm President and CEO of the International AIDS Vaccine Initiative, or IAVI, which is a not-for-profit product development organization that specifically works to develop vaccines and other interventions to address major public health threats that disproportionately impact people living in low-income countries. And one of the innovations that we're advancing is a vaccine to protect against Lassa fever, which currently there is no available vaccine. I'm here at the ECOWAS International Lassa Fever Conference in Abidjan, Côte d'Ivoire, and it's been a really productive meeting. First, I'm really excited to see how much enthusiasm and commitment there is on the part of the participants in the meeting. I think the number of participants is much greater than was originally imagined, so it really highlights how much interest there is in coming up with solutions to address this disease, Lassa fever, that causes significant negative impact across the West African region, and especially in Nigeria, where the burden of the disease is highest. Secondly, I've been really impressed with the commitment of ministers of health throughout the WAHO region in their commitment to really working together to do something about Lassa fever and really taking a leadership role in shaping how innovations can be developed to benefit the populations of the countries that they serve, which is very positive, not only the level of their commitment, but their commitment to working together to do this. And the hope would be that rather than depending upon higher income countries to develop innovations that then might eventually reach people living in low and middle income countries, where countries in this region could take the responsibilities to help drive the development of solutions to address very important public health threats that affect their populations. And a couple of additional things that I would like to highlight is just the level of participation from researchers and public health officials from Nigeria has been exceptionally impressive. Their expertise, their dedication is critically important for making progress on the efforts to control Lassa fever. And I also want to applaud Minister Mohamed Pate, who has played a leadership role in really bringing together all of the ministers of health from countries across the West African region to really come together to commit to working together to deliver solutions against this important disease. His influence is very evident in their willingness to come together and their shared commitment that has emerged from discussions at a ministerial forum that took place yesterday. Number three, I'm really excited about the level and sophistication of the discussions here. There's important progress that's being made. There's much more that needs to be learned, but I think the level of commitment, the level of energy, the level of insight, and the spirit of collaboration is a really very promising feature of this meeting, and makes me very optimistic about the future efforts to really control Lassa fever and eliminate it as a public health threat for West Africa. And because there are reasons to believe with climate change and other changes that Lassa fever will be expanding across Africa, we really need to develop innovations that limit this disease and hopefully can one day eliminate it, because the clock is ticking and we have a lot of work to do.